Tuberculosis, often referred to as TB, is a contagious infection that primarily targets the lungs but can also affect other parts of the body such as the bone, brain, and spine. It is caused by a type of bacteria known as Mycobacterium tuberculosis. This disease has been a persistent threat to human health, with its existence traced back to ancient times. The discovery of TB and its causative agent, Mycobacterium tuberculosis, is credited to Dr. Robert Koch, who announced his findings on March 24, 1882. At the time, TB was responsible for 1 out of every 7 deaths in the United States and Europe. Dr. Koch's discovery marked a significant milestone in the fight against this deadly disease, paving the way for further research and the development of treatments. In terms of the current epidemiology of TB, it continues to be a significant global health issue. As of 2022, an estimated 10.6 million people fell ill with TB worldwide, including 5.8 million men, 3.5 million women, and 1.3 million children. A total of 1.3 million people died from TB in 2022, including 167,000 people with HIV. TB is present in all countries and age groups, and it is the second leading infectious killer after COVID-19, surpassing HIV and AIDS. TB is caused by the Mycobacterium tuberculosis bacteria, which are slow-growing and thrive in areas of the body that are rich in blood and oxygen, such as the lungs. The bacteria are spread from person to person through the air. When a person with TB disease of the lungs coughs, sneezes, speaks, or sings, they release TB bacteria into the air, which can be inhaled by people nearby. However, not everyone infected with the bacteria becomes sick. Individuals with weakened immune systems are at a higher risk of falling ill from TB. These include people with HIV, malnutrition, or diabetes, or people who use tobacco. TB is characterized by a range of symptoms, which may vary depending on the specific organ affected by the disease. However, when it affects the lungs, which is the most common occurrence, symptoms include a persistent cough that lasts for more than 2 weeks, coughing up blood or sputum, chest pain, unintentional weight loss, fever, night sweats, and loss of appetite. It's important to note that not everyone infected with TB bacteria becomes sick. As a result, 2 TB-related conditions exist: latent TB infection and TB disease. People with latent TB infection do not feel sick, do not have any symptoms, and cannot spread TB bacteria to others. Diagnosis of TB involves several tests. A skin test, also known as the Mantoux tuberculin skin test, is often used to determine if a person has TB bacteria in their body. Sometimes the results of the tuberculin skin test are vague, especially in a person who has been vaccinated with BCG or who live in areas where non-tuberculous mycobacteria are highly prevalent. To improve diagnostic accuracy, whole blood interferon gamma releasing assays, or IGRAs, have been commercially developed. If the skin test, or the IGRA test is positive, additional tests are required to confirm if the person has latent TB infection or TB disease. These may include a chest X-ray or a sputum test, which checks for the presence of TB bacteria in the phlegm. Treatment for TB disease typically involves taking several drugs for a long period. It is crucial to finish the medicine and take the drugs exactly as prescribed by the healthcare provider. For active TB disease, treatment usually involves a combination of several drugs, often for a period of 6 to 9 months. However, in some cases, such as multi-drug-resistant TB, or MDR-TB, treatment might require 18 to 24 months or longer. For latent TB infection, several treatment regimens are recommended in the United States, including short-course, rifamycin-based, 3 or 4-month treatment regimens. If these short-course treatment regimens are not feasible or available, 6 to 9 months of isoniazid monotherapy are alternative and effective latent TB infection treatment regimens. It's important to note that all treatment must be taken exactly as prescribed by the healthcare provider. If you stop taking the drugs too soon, you can become sick again. If you do not take the drugs correctly, the bacteria that are still alive may become resistant. Multi-drug-resistant TB, or MDR-TB, remains a public health crisis and a health security threat. Only about 2 in 5 people with drug-resistant TB access treatment in 2022. Global efforts to combat TB have saved an estimated 75 million lives since the year 2000. However, $13 billion is needed annually for TB prevention, diagnosis, treatment, and care to achieve the global target agreed at the 2018 United Nations High-Level Meeting on TB. Prevention of TB involves several measures. The BCG vaccine, which stands for Bacillus calmette-guerin, is often given to infants and small children in countries where TB is common. However, this BCG vaccine is not generally recommended for use in some other countries, for instance the United States. This may be due to the low risk of infection with Mycobacterium tuberculosis in such countries, the variable effectiveness of the vaccine against adult pulmonary TB, and the vaccine's potential interference with tuberculin skin test reactivity. Nevertheless, the BCG vaccine may be considered for certain people with significant risk factors for prolonged exposure to TB. For example, the Centers for Disease Control and Prevention, CDC, recommends that the BCG vaccine be considered for some children with a high risk of developing TB, including those who live with adults who have untreated, ineffectively treated, or drug-resistant TB. Other preventive measures include wearing a mask if a family member is infected, avoiding large gatherings, washing hands or sanitizing regularly when outside the house, and keeping the house sufficiently ventilated. In conclusion, TB remains a significant global health challenge, but with early detection, appropriate treatment, and preventive measures, it can be controlled and eliminated. Continued research and public health efforts are essential to combat this disease and improve global health outcomes. The goal is to end the TB epidemic by 2030, which is among the health targets of the United Nations Sustainable Development Goals, or SDGs. Despite the challenges, the fight against TB has seen significant advancements. And with sustained efforts, the goal of a TB-free world can be achieved. That is the end of today's video about tuberculosis, or TB. If you have any questions or any thoughts, please write it down below. Don't forget to drop a like and subscribe, and feel free to visit the channel for more videos. Thanks for watching.